morning. I'm Dr. Schuster, and thank you very much for all of those who have sent me in ideas to talk about. The first idea, or first request, asked me to speak about the differences between PRP, platelet-rich plasma, and the differences between that and platelet PRF, as in Frank, platelet-rich fibrin. Now, I do have a good amount of experience with PRP. I do not have any clinical experience with PRF, but I know a bit about it, and these are the differences. PRP is sort of like the first generation of platelet concentrates. And the PRP has been used in plastic surgery, dental procedures, orthopedics is very big. And it is primarily used to decrease the inflammation and promote healing, okay? And we have extensive experience using PRP with microneedling, which is a procedure that helps fine lines and helps stimulate collagen in the face. But primarily it helps to speed up the healing process and decrease the amount of redness that you can get with microneedling, which doesn't really last for very long, but it's better to have almost no redness rather than 2 to 4 days of redness. PRF is the second generation of platelet concentrates, and so what that does is in addition to the platelets, it's actually utilizing something which is called fibrin to help trap the platelets, and it is the platelets that are releasing all of these growth factors. So what am I really talking about? In blood, there are the cellular components, which are the red blood cells, the white blood cells, and the platelets, and there's the non-cellular portion of it, which is called plasma. There are also some other little things like hormones and electrolytes, but the primary ingredients of whole blood are the cellular components and the plasma, which is the sort of the liquid part of it. And what is inside of that liquid is very important, because one of the things that is inside that plasma watery component is something called fibrinogen. And all of this has to do with your body's ability to heal and to clot. So when you cut yourself and you're bleeding, your body's response is to stop that bleeding through the clotting mechanism, okay? It's a very intricate pathway of how all of this happens, but the two big things I want to bring to your attention are the fibrinogen and the platelets, okay? The fibrinogen gets stimulated to produce fibrin, to coagulate, and what that does is it forms a network. It's like a spider web accumulation of these fibers called fibrin. And then the platelets also help to produce the coagulation to stop the bleeding. But also platelets they release all of these growth factors, which is what we're really trying to capture, especially during aesthetic procedures. So PRP draws the process is that you draw blood and you use a centrifuge to concentrate those platelets. The first generation used tubes which contained an anticoagulant, which did not allow the coagulation process to occur, okay? So as a result, you get a concentrated amount of these growth factors, which are typically used with the microneedling, and they're released. They don't last very long. They last probably for about 12 to 36 hours, okay? PRF does not use the anticoagulant, so therefore your blood actually is coagulating in that tube. It's centrifuged, and so it's concentrated. So now what we're doing is we're concentrating the platelets within that fibrin network. And then when that is injected into the area, the platelets are sort of trapped, and it's a much more gradual release of their growth factors. So you get a prolonged release, and that prolonged release is thought to help actually stimulate the fibroblasts and actually produce more collagen. And that's the difference. And so the results from PRF, and again, I have not personally used it, but my understanding is that the results of PRF are going to be better than PRP when it comes to actually producing collagen and helping fine lines, texture, darkness within the skin, especially in the lower eyelid area. So, so I think it is an important advancement, and I think it's worth looking into. Again, I am not currently using it, but I'm strongly considering using it, and it does show a lot more a lot more promise, and it's also a little bit of an easier process to perform in the office. So there you have it. That's my understanding. Hopefully this has helped you, and stay tuned for more answers to more questions, and keep them coming in. Thank you very much.